Beta-carotene is a plant pigment and it's found in colourful fruits and vegetables, and it's converted into vitamin A inside the body. It plays an important role in human growth, vision, and in support of the immune system. In people with HIV who were given 100,000 international units of vitamin A from beta-carotene every day for 4 weeks, the white blood cell count rose 66%, and the T helper cell rose slightly. 6 weeks after stopping the beta-carotene treatment, the immune cell measurements returned to their pre-treatment levels. In Uganda, a study involving 181 children with HIV had vitamin A supplementation, and it was associated with significantly lower mortality rates, as well as improvements in chronic diarrhea and persistent cough. In another study, 687 children in Tanzania with pneumonia received 400,000 international units of vitamin A at baseline, as well as 4 months after the discharge, and then 8 months after the discharge. None of the children showed any signs of vitamin A deficiency when they started the treatment. The vitamin A supplementation was then associated with a 49% drop in mortality and a 92% decrease in diarrhea-related death, plus AIDS-related death plummeted 68%. In a population of South Africa that's not generally vitamin A deficient, children with HIV-infected mothers received 50,000 international units of vitamin A at age 1 month and 3 months, 100,000 international units at 6 months and 9 months, and then 200,000 international units at 12 months and 15 months. This resulted in a significant reduction in morbidity from diarrheal disease. In the US, a study involving HIV-infected children had the use of vitamin A supplementation prior to influenza vaccine, and it muted the increase of the HIV viral load post-immunization. Weight retention improved among South African HIV-infected women with vitamin A supplementation. Conversely, vitamin A deficiency in HIV-positive women has been associated with increased mother-to-child transmission of the infection. However, the potential value of vitamin A supplements in pregnant women with HIV remains questionable, particularly as some of the studies have indicated that vitamin A supplementation might increase the HIV load in breast milk, and it might potentially elevate the risk of HIV transmission from mother to child. A recent review of studies encompassing 6,517 women with HIV in South Africa, Zimbabwe, Malawi, and Tanzania found vitamin A supplementation use among the HIV-infected pregnant women correlated with improved birth weight, although the review found no evidence that vitamin A supplements increased the risk of mother-to-child transmission of HIV. The authors pointed out the moderate quality of the scientific evidence in these studies. B vitamins are responsible for an array of important functions within the body, including the proper functioning of the brain and the immune system. A number of reports have documented the beneficial effects of B vitamin supplementation in people with HIV. In a study involving 281 HIV-infected patients, taking vitamin B6, B1, or B2 was independently associated with improved survival. In 108 HIV-infected men who were tracked over an 18-month period, low B12 levels at the beginning of the study were significant predictors of faster disease progression, as determined by the CD4 cell count. Although the development of B12 deficiency corresponded with a drop in CD4 cell count, the normalization of the B12 levels corresponded with higher CD4 cell count. Omega-3 fatty acids are essential oils. They're not made in the body and they need to be converted from external sources. Their anti-inflammatory and immune modulating capability make them a valuable component of general health. Additionally, they appear to have therapeutic value for people with HIV who suffer from high triglyceride levels. A number of published medical reports have described changes in lipid metabolism, increased levels of serum triglycerides, and low levels of HDL cholesterol in people with HIV. Moreover, the combination antiretroviral treatment is reported to be a risk factor. A combination of dieting and omega-3 supplements at 6 grams per day was found to cause a major drop in serum triglycerides and levels of arachidonic acid. A small systematic review found varying doses of omega-3 fatty acids caused significant reductions in triglyceride concentrations in people with HIV who were taking the antiretroviral therapy. A study involving 48 HIV-infected patients with HAART-associated hypertriglyceridemia found a 12-week course of omega-3 fatty acids at 4 grams a day led to a significant reduction in the triglyceride level compared to the placebo. It was found that the omega-3 fatty acids plus dietary and exercise counseling lowered the fasting triglyceride levels in the HIV-infected patients with hypertriglyceridemia who were taking the antiretroviral medication. However, the difference was not significant compared to the participants who received counseling without the fish oil supplements. In other studies of HIV-infected patients with elevated triglyceride levels who were using antiretroviral therapy, omega-3 supplementation was associated with a significant decrease in the triglyceride levels. Whey protein contains all the essential and non-essential amino acids, and these are important for maintaining an adequate immune system response. Whey is also an important supplement to help to boost the body's synthesis of glutathione, and various therapeutic benefits, including its immune-enhancing properties, and it makes it of great interest for people with HIV. In a study involving 41 HIV-infected patients who received 40 grams of whey protein per day, they benefited from a CD4 count increase of 31 cells per microliter versus the control group, which showed a decline of 5 cells per microliter over the same 12-week period. Whey protein has been found to improve the immune function, to elevate cellular glutathione levels, and to maintain muscle mass. Lactoferrin is derived from whey protein, and it's been found to inhibit viruses by binding to viral receptor sites, thus preventing the virus from infecting healthy cells. In vitro studies show that lactoferrin is an effective inhibitor of HIV entry. It can also effectively inhibit the initial HIV infection by blocking the uptake into the epithelial cells and transfer from dendritic cells to CD4 cells. One study compared 22 asymptomatic and 45 symptomatic patients with HIV to 30 healthy control subjects, and it found the plasma lactoferrin levels were decreased in the patients who were infected with HIV. In a 6-month trial involving 22 HIV-infected children, the oral lactoferrin caused a small decrease in the viral load and an increase in the CD4 cells. The lactoferrin plus antiretroviral therapy was more effective than the lactoferrin alone. CoQ10 is present in all the cells of the human body, and it's essential for the proper cellular function. Low levels of CoQ10 have been detected in people with HIV, and one study found the level of CoQ10 deficiency corresponds with the stage of the HIV infection. CoQ10 supplementation increases a number of immune parameters, including the T cell counts, which are an important consideration in HIV. A known antioxidant, the CoQ10 has been found to contribute to the improvement of the antioxidant defenses in HIV-infected men when administered as part of a regime consisting of various antioxidants. In a case study involving a 52-year-old man with HIV, the patient suffered from drug-related skeletal myopathy caused by the drug. The daily supplementation with CoQ10 led to recovery, allowing the patient to continue his HIV drug treatment. A water-soluble formulation of CoQ10 on cultured rat cells was found to be effective in preventing neurotoxicity caused by the D4T. Although studies on the effects of CoQ10 in HIV are limited, the findings so far highlight it as a promising area of study. Selenium is required for the proper immune system function, and it facilitates a multitude of antioxidant activities in the body. It also decreases the effect of inflammatory cytokines, which may reduce the risk of developing neurological damage. In people with HIV, selenium deficiency has corresponded with disease progression to AIDS or death. It was found among HIV-infected drug users that low selenium was a significant risk factor for developing mycobacterial disease. The HIV-inhibiting effects of selenium has also been observed in human cell cultures. In human studies, selenium supplementation has been found to reduce the incidence of diarrhea and decrease the number of patient hospitalizations. On average, patients with HIV and AIDS who have low zinc levels have a higher viral load and a lower T-cell count. A US study of 231 HIV-infected adults found taking zinc supplements every day for 18 months reduced the rate of diarrhea by more than 50% compared with a placebo, and it lowered the risk of immunological failure by 400%. However, it did not affect the viral load, nor did it have an impact on mortality. In a literature review of 6 human studies involving 1,009 participants, the use of zinc supplements appeared to decrease the opportunistic infections among the adults and children with HIV. Only the adults were found to have higher CD4 counts. No adverse events were reported for the adults or the children using the zinc supplementation. Some antiretroviral drugs appear to chelate magnesium post-interaction. Therefore, supplementation with magnesium might ensure the magnesium levels are not depleted. The human gut contains naturally growing bacteria that possess an array of beneficial functions. These include their ability to produce essential nutrients to the body, to break down foods that are otherwise undigestible via fermentation reaction, and to prevent the growth of harmful pathogens. However, the gut is largely compromised in patients with HIV. Acute HIV infection is marked by the dramatic depletion of the CD4 cells from the gastrointestinal tract. The gastrointestinal tract is believed to be a particularly attractive target for the HIV replication because the CD4 cells it contains are primarily CD4+ memory cells, and these are preferential targets for the HIV replication. Moreover, the CD4 cells in the gastrointestinal tract express substantial amounts of CCR5, a receptor commonly used by HIV to enter and to infect cells. As HIV depletes the gut immune cells, intestinal epithelial permeability generally increases, and the human host becomes increasingly vulnerable to microbial invasion and disease progression. Probiotics are living microorganisms, and when provided in sufficient quantities, impart health benefits. Certain strains of probiotics are associated with reduced inflammation and permeability, both of which are of notable interest for patients with HIV. In several studies involving people with HIV and AIDS, consuming probiotics was associated with improvements in the CD4 cell count. More recently, it was found adding probiotics to micronutrient-fortified yogurt did not boost the CD4 cell count after 1 month, versus the same preparation without the added probiotic. Although the added probiotics were well tolerated and no adverse events were reported. Larger clinical studies with follow-up periods would be needed to fully assess the impact of probiotic supplementation on people with HIV, as there are numerous different strains of probiotics with different benefits. Reishi mushroom is native to Asia, and it's a highly valued part of traditional herbal medicine for centuries. It's been used to treat a wide range of health problems and to promote a long life, but it's most commonly used as an immune-enhancing supplement. Several studies have demonstrated reishi's immune potentiating ability. A preliminary study included 5 monkeys with simian-acquired immunodeficiency syndrome, which was caused by inoculation with a virus that's closely related to HIV, called the simian immunodeficiency virus. 3 of the monkeys received the reishi extract, and 2 received no treatment for 1 year. The treated monkeys had a higher survival rate, and the surviving monkeys experienced a decrease in viral load and less damage to the lymphatic and other tissues. Reishi's active constituents include triterpene compounds and polysaccharides, and these constituents are central to reishi's antiviral and anti-cancer effects, as well as reishi's ability to stimulate the immune cells. The triterpenes and related compounds from the reishi have been found to have specific anti-HIV-1 activity. The reishi also contains proteins, fibers, phenolic compounds, minerals, vitamins, and other potentially beneficial constituents. Extracts from the reishi have been found in lab and animal studies to modulate both the innate and the adaptive immunity, stimulating the macrophages, the T cells, both the CD4, CD8, lymphocytes, as well as others, the B cells, dendritic cells, and natural killer cells, and altering the balance of other chemicals called cytokines that regulate the immune cell activity. Both its antiviral and general immune-enhancing properties make the reishi a good choice for individuals with HIV. For more on AIDS, HIV, or herbs, supplements, and natural treatment plans, check out my website.